Welcome, and thank you for joining us today. This presentation is titled Building Capacity to Provide Culturally Safe Care, an approach to reducing harm and removing barriers for Indigenous women and gender-diverse people who use cannabis. As a note, throughout this presentation, the phrase Indigenous women and gender-diverse people will be utilized, and we'd like to clarify that this also encompasses people who are two-spirit, transgender, and of other gender diversities. Throughout this one-hour training, we'll explore how to strengthen understandings and approaches to cannabis care in a way that respects Indigenous perspectives, addresses trauma, and reduces stigma. This training aims to equip you with the tools and insights to provide more compassionate, inclusive, and effective care. This presentation will be comprised of 6 sections. These include a background context, addressing stigma and discrimination, trauma-informed care in health settings, understanding cannabis use and harm reduction, a case study, and Indigenous cannabis initiatives and resources. Let's begin by exploring the background of this project. We'll provide an overview of the Native Women's Association of Canada's Cannabis Project and outline the learning goals for today's session. To guide our discussion, we'll also highlight key Indigenous learning lenses that will help us frame our approach. As a disclaimer, the information presented today takes a pan-Indigenous approach to understanding cannabis. While the content has been developed from diverse community voices across the country, it's important to recognize that the information throughout is not representative of the opinions and feelings of all Indigenous individuals or communities. Funded by Health Canada's Substance Use and Addictions Program, the Native Women's Association of Canada, or NWAC for short, has conducted ongoing engagement and research to identify and improve the critical gaps in culturally safe and stigma-free cannabis education. This project takes a new approach to a long-standing dilemma. As more and more Indigenous women and gender-diverse people choose to use cannabis in its many forms, there still exists a lack of information available to health and social service providers, whether they're new to practice or have been practicing for years. This emerged as a priority topic during community engagement sessions and has highlighted the need for more Indigenous-led education that reduces the stigmatizing and oppressive norms. Cannabis use may serve a variety of purposes, from recreational use to harm reduction. As a safer alternative to other substances, it can be used as medicine for a range of conditions and for many other valid reasons. This project aims to provide health and social service providers with the foundational language and knowledge needed to enhance culturally safe care for Indigenous women and gender-diverse people who use cannabis. To accomplish this, NWAC has developed tailored webinars for 3 distinct groups, each with unique roles and learning needs. Today's webinar focuses on allied health professionals. While the learning objectives remain consistent across all 3 webinars, the approach and examples of each are tailored to align with the different professions' needs and responsibilities. To ensure this project reflected the voices and needs of Indigenous women and gender-diverse people, a 7-member advisory circle was established. The circle brought together Inuit, Métis, and First Nations partners and included an elder, knowledge keepers, and representatives from primary care, allied health, and social service fields. The advisory circle collaborated across 8 content development meetings. Through sharing both their lived and professional experiences, their insights have provided the culturally safe and trauma-informed knowledge that will be presented throughout today's session. Their dedicated work has ensured that this project remains meaningful, relevant, and responsive to the needs of Indigenous women and gender-diverse people who use cannabis. Prior to developing the webinars, NWAC surveyed 45 health and social service providers to better understand the current gaps in training and knowledge related to cannabis use and culturally safe care. From the results, 4 key learning goals emerged. They are understanding the difference between problematic and medicinal cannabis use. So by examining the distinctions between these patterns, providers can better support patients and recognize when cannabis use serves a therapeutic role versus when it might be a source of harm. Address stigma and personal views. Stigma around cannabis use remains a significant barrier, both in patient-provider interactions and within healthcare systems. Through learning more about Indigenous perspectives and discussing cannabis use, we'll aim to reduce stigma and create more supportive environments. Discuss therapeutic approaches. We'll do this by discussing harm reduction, trauma-informed care, holistic health principles, and understanding cannabis use in a way that respects Indigenous perspectives and experiences. And lastly, we'll present resources and ongoing education materials. Since knowledge and practices are continually evolving, we'll highlight a variety of tools and resources that can support your ongoing learning and enable you to provide more informed and compassionate care. As we move through the presentation, you're encouraged to activate your two eyes and consider how both your trained perspectives and Indigenous knowledge can be used together to better support patient health and well-being. Two-eyed seeing is a concept that Mi'kmaq elder Albert Marshall introduced to encourage people to view the world through two perspectives. One eye focuses on Indigenous ways of knowing, while the other eye on Western scientific knowledge. By combining the strengths of both eyes, we can foster a respectful balance and create more holistic solutions. For example, this could look like working to integrate culturally significant foods into someone's diet while also considering Western nutritional guidelines, or collaborating with a traditional knowledge keeper to incorporate ceremony or medicine into someone's mental health treatment plan. It's ultimately about recognizing the importance of fostering balance between culture and clinical approaches. By incorporating Indigenous practices into care plans, you can help build bridges between Western and Indigenous methods and ensure that health solutions honor your patient's cultural values. That leads directly into supporting holistic health. I'm sure you've heard of the World Health Organization's definition of health. That's a state of complete physical, mental, and social well-being, and not merely the absence of disease. This aligns really similarly with Indigenous perspectives of holistic health. Indigenous knowledge emphasizes the interconnectedness of all aspects of health, which can be visually represented through a circle of balance. While the medicine wheel is a well-known framework for this concept, it's important to acknowledge that it's not universal to all Indigenous groups. However, the idea of striving for balance is a shared principle across many communities. This concept of balanced health encompasses physical, mental, emotional, and spiritual dimensions, with each being equally as important in achieving well-being. When one's out of balance, the others are impacted. For example, physical health is often the center of Western health approaches and treatments, but it's equally as critical to nurture our mental well-being, as it's fundamentally interwoven in with our physical state. Further, our relationships and our feelings, or emotional health, deeply influence our mental state. And spiritual health gives many people a sense of purpose and connection to traditions, providing grounding and resilience. Together, these dimensions create a complete version of health that emphasizes balance, rather than focusing on one aspect alone in isolation. As we move forward, whenever the word health is broadly mentioned, please keep this definition in mind. With this foundation in place, let's begin by exploring key issues that shape health outcomes. This section will look at how to address stigma and discrimination in health settings, ensuring cultural safety and minimizing barriers for Indigenous women and gender-diverse people. Let's start by addressing three critical concepts that significantly impact the healthcare experiences of Indigenous people: racism, stigma, and discrimination. Understanding these terms is essential for recognizing how they affect both individuals and systems. Racism is the belief that people of different races possess distinct characteristics and abilities that make them inherently superior or inferior. In the context of Indigenous people, this belief often leads to invalidation and inappropriate care based on the misconception that Indigenous knowledge or practices are less valuable than Western ones. Stigma refers to negative attitudes, beliefs, and behaviors towards individuals or groups because of their circumstances or identity. For Indigenous people, stigma may be tied to their cultural practices, socioeconomic status, or health conditions. This can create significant barriers to accessing care and seeking help, as many individuals also internalize these negative views. Discrimination is the unequal treatment of individuals based on characteristics such as race, gender, age, disability, or identity.
In healthcare settings, this can manifest as unequal access to resources, biased treatment, or withholding services based on an individual's background. Indigenous women and gender-diverse people are particularly vulnerable to discrimination in healthcare. It's important to acknowledge the systemic and historical roots of these issues. The racism, stigmatization, and discrimination experienced by Indigenous people is not random or simply isolated events, but instead, these are a result of intentional design. Historic and ongoing acts of colonization have created deep systems of inequity for Indigenous people. Through various intersecting violent measures, systems of injustice have been solidified and remain especially present in healthcare settings. From the attitudes of providers to the policies that govern healthcare access, racism, stigma, and discrimination shape how Indigenous people are treated. What makes addressing these issues complex is the multiple levels at which they operate. Structural. These are the forms of discrimination that are embedded in the policies, practices, and systems of institutions. For example, the lack of culturally relevant healthcare services or the unequal allocation of resources to Indigenous communities. At the social level, racism, stigma, and discrimination manifest in attitudes, social norms, and behaviors that perpetuate stereotypes. This can include things like social isolation of Indigenous patients or the use of stigmatizing language by healthcare professionals. At the individual level, biased and discriminatory actions can be seen in the behavior of healthcare providers. For instance, making assumptions about Indigenous patients' lifestyles or needs based on stereotypes can significantly affect the quality of care provided. As we move forward, keep these different levels in mind. The impact of racism, stigma, and discrimination is incredibly complex and interconnected. Bias, in the context of healthcare, refers to preconceived notions that influence how we perceive and treat others, often based on their race, gender, or other attributes. These biases can stem from cultural, social, and historical influences, which is especially important to consider when working with Indigenous women and gender-diverse people. Biases can deeply affect healthcare outcomes, making it essential for healthcare professionals to recognize and confront them. Two main types of bias affect healthcare practice: implicit and explicit. Implicit bias refers to unconscious assumptions that can influence decision-making without the person's awareness. For example, a healthcare professional might unconsciously assume that Indigenous patients are less likely to adhere to treatment plans due to a perceived lack of interest in health or wellness. Without realizing it, the provider may deliver less comprehensive care, such as offering fewer treatment options, omitting detailed explanations, or skipping follow-up plans because they unconsciously expect that the patient will not fully engage. This kind of bias often stems from societal stereotypes, rather than the patient's actual behavior or intentions. Explicit bias, on the other hand, involves conscious beliefs and stereotypes. For instance, a dietitian might assume that all Indigenous patients have poor nutrition habits due to a perceived lack of personal responsibility. This bias can result in knowingly offering minimal dietary guidance or failing to recommend community support services, believing that a patient will not take the advice seriously or follow through. Such assumptions ignore structural issues like food insecurity, geographic isolation, or the impact of colonial policies on traditional food practices. Both implicit and explicit biases overlook the systemic barriers Indigenous patients often face, such as historical trauma, socioeconomic disparities, and limited access to culturally appropriate care. These biases reduce complex health issues to personal responsibility failures, which can lead to decreased trust in healthcare providers and a reluctance to seek care. This only further exacerbates the health issues people are experiencing. To effectively address bias in healthcare, several strategies can help professionals build awareness and improve patient outcomes. Self-reflection is a vital first step. Regularly pausing to ask, am I making assumptions based on stereotypes? Or how might my personal beliefs be influencing this interaction? This helps uncover unconscious biases and fosters a more mindful approach to care. Ongoing education is another key strategy. Continuously learning about Indigenous cultures, histories, and the unique challenges Indigenous women and gender-diverse people face ensures providers are better informed and equipped to deliver appropriate care. Patient engagement is equally important. Asking open-ended questions, listening actively, and prioritizing relationship building ensures care is collaborative and responsive to the patient's specific needs and preferences. This not only enhances trust, but also promotes shared decision-making, an essential aspect of equitable care. And finally, seeking feedback from both patients and colleagues is critical. Honest feedback helps identify areas where biases may still be influencing care and offers opportunities for growth. It also reinforces a culture of accountability, ensuring that healthcare practices remain inclusive and patient-centered. Together, these strategies lay the groundwork for more equitable care, paving the way towards cultural safety, a concept that will be explored next. Cultural safety is an essential framework for ensuring equitable, respectful, and inclusive care. Unlike cultural awareness or sensitivity, cultural safety goes beyond understanding or acknowledging cultural differences. It focuses on creating environments where power imbalances, discrimination, and stereotypes are actively addressed and eliminated. This framework acknowledges and addresses the ongoing effects of colonization, intergenerational trauma, and systemic racism. It requires understanding how these factors have deeply affected Indigenous people, while centering Indigenous knowledge systems, practices, and voices in all aspects of care. Cultural safety aims to foster trust by creating environments where patients feel respected, valued, and truly understood. By integrating cultural practices and honoring patients' lived experiences, providers can help mitigate feelings of marginalization and create a foundation for meaningful collaboration. As health professionals, fostering cultural safety starts with introspection. Reflect on the power dynamics present in your relationship with patients. Are you making decisions for them, or are you working alongside them? Consider your own biases and take deliberate steps to challenge stereotypes or assumptions that may unconsciously inform your actions. A powerful tool in this process is self-reflection. Ask yourself, am I a safe person to work with? What would make me safer in the eyes of my patients? These questions are not a one-time consideration. They're an essential part of ongoing practice. By regularly reflecting and adapting, you can continuously improve your ability to provide culturally safe care. These actionable strategies aim to reduce barriers experienced by Indigenous women and gender-diverse people when accessing healthcare services. First, promoting cultural safety and understanding is essential. In addition to the points mentioned earlier, health professionals can deepen their knowledge by engaging in ongoing training focused on Indigenous histories, traditions, and worldviews. Building informed, trusting relationships ensures that patients' cultural identities are respected, creating a foundation for culturally safe care. Second, addressing systemic barriers requires advocacy and practical interventions. Health professionals can help by connecting patients to critical resources, such as housing, affordable food options, advocating for policy changes, and helping remove barriers like transportation, financial costs, language challenges, or even physical barriers like accessibility issues. Ensuring the services you provide and recommend are culturally safe is fundamental to promoting equitable access to care. And finally, emphasizing collaboration in care planning strengthens support systems. Engaging in holistic teamwork with diverse health and social service providers enables effective coordination of services, referrals, and community support. You can also share fact sheets and other accessible resources that are tailored to the specific needs of the patient, helping them navigate their cannabis treatment with the information they need. A collaborative approach to care planning ensures that patients' primary care, allied health, and community needs are met comprehensively. It's also critical to consider how lived experiences shape interactions within healthcare settings. Let's explore how a trauma-informed framework can help us better understand and address the impacts of trauma. Trauma itself is a response to distressing events, whether that's a single incident or prolonged exposure to adversity. It affects holistic health and well-being and fundamentally shapes how people perceive and interact with the world around them. A trauma-informed approach to care recognizes how common trauma is and how it affects all aspects of people's lives, including their interactions with healthcare providers.
The goal is to create a safe space where patients feel supported and in control. For Indigenous women and gender-diverse people, this means understanding how historical and ongoing acts of colonization continue to shape their lived experiences. It's also critical to understand that trauma-informed care doesn't mean asking patients to relive or reflect on their trauma. Instead, it shifts the focus to their strengths, the resilience that they've developed in surviving trauma, and how that resilience can become a foundation for healing. When this approach is not utilized, there's a risk of causing re-traumatization, which can leave patients feeling unsupported or even blamed. This could discourage them from seeking services again, further exasperating barriers to care. This process of becoming trauma-informed requires you to first recognize how significant the impacts of colonization are on the lives of Indigenous women and gender-diverse people. Historic and ongoing processes, such as the residential school system, the 60s and millennial scoop, the foster care system, forced and coerced sterilization, gender-based discrimination within the Indian Act, high rates of incarceration, the theft of land and resources, among many other factors, have all had deep intergenerational effects. Acknowledging that these things impact your patient is critical for helping you to create culturally safe environments and offer compassionate care. All of us carry a set of values, formed by a variety of influences over our life course. These values, whether conscious or subconscious, inform how we engage with others. It's also important to recognize how our work is influenced by our own perspectives, and to question how structural racism, discrimination, and biases have been built into health and social service systems. We must consider how these systems specifically affect Indigenous women and gender-diverse people's ability to access services in a respectful and dignified way. Through these reflections, we can begin to apply two-eyed seeing. This allows us to recognize and respect the ways that traditional knowledge and biomedicine can coexist. Integrating these approaches simultaneously provides an opportunity for patients to make more culturally relevant, balanced decisions regarding their health. Some further tips for providing trauma-informed care are that it's important to remember you don't need to know the specific trauma a person has experienced to provide trauma-informed care. What matters is creating a safe, supportive environment where patients feel respected and heard. Be mindful of your positionality and privilege. This means recognizing how your own identity, background, and experiences influence your interactions with patients. For instance, avoid medical jargon and use plain language to ensure shared understanding. Let people know that you want to work with them and don't simply tell them what to do. Another key aspect is practicing empathetic listening. It's about listening with intention, without interrupting or rushing to solve the problem, and without imposing your own beliefs or assumptions. Ask patients how you can make their visit or appointment more comfortable. And finally, helping patients to make decisions that best support their holistic health and well-being is central to trauma-informed care. Providing patients with the information and options that they need to make choices that feel right for them while respecting their autonomy helps foster resilience and healing. Next, we'll be discussing how to recognize and respond to trauma activation. As a note, we'll be using the term activate instead of trigger when referring to something that awakens a memory, feeling, or symptom related to trauma. The reason for this change is that the word trigger can carry violent connotations, which can intensify the emotional response. Our advisory circle elder explained that trauma is energy that's physically locked within the body. Using the term activate is a gentler way to describe the experience without causing further harm. Trauma activation can occur in response to various stressors, including environmental, sensory, or interpersonal cues. These might include specific sounds, smells, places, sensations, confrontations, or even particular words or phrases. Activations are deeply personal and unpredictable, so it's essential to remain attuned and sensitive during interactions. There are several signs to look out for when someone's experiencing a trauma activation. Physical signs may include increased heart rate, sweating, shaking, or appearing physically frozen. Emotional responses can range from fear, anger, and sadness to shame or numbness. Behavioral signs include avoidance, hypervigilance, unexpected outbursts, or freezing. On a cognitive level, individuals may be experiencing flashbacks, intrusive thoughts, confusion, or distorted thinking. Recognizing these signs allows us to provide appropriate and sensitive support. When responding to a trauma activation, the first step is to validate the person's experience. Acknowledge their feelings without judgment and let them know that their emotions are valid. Create a safe and calm environment where they feel secure. Offering grounding or coping techniques such as deep breathing or sensory focus exercises can help, but it's essential to let the person guide the process and choose what feels right for them. Be patient and avoid pushing them to share more than they're ready for. Above all, it's important to ensure that they feel in control of the situation. Experiences of trauma often leave people to feel powerless. As a care provider, it's important to ensure that they have options and control over what happens next. This could look like asking if they want to stop the consultation, if they want to continue, take a break for a few minutes, among other things. By understanding common stressors, recognizing the signs of activation, and responding with empathy and care, you can create a supportive space that fosters trust and helps individuals feel safe. Finally, having a trusting relationship is an essential foundation for providing trauma-informed care. This can be fostered by creating safe physical and emotional environments where patients feel respected and free from judgment. In a physical space, this could look like rooms being soundproof and more private, ensuring accessible design features like ramps, wide doorways, and clear signage, or even incorporating calming colors throughout. Emotional safety can be achieved by using inclusive language, being mindful of pronouns, and ensuring that staff are trained in understanding diverse identities, including those of two-spirit, transgender, and gender-diverse people. Setting clear and consistent boundaries can foster trust and predictability in a patient-provider relationship. This includes being clear about expectations, maintaining consistency in how you engage, and allowing space for people to ask questions or express concerns as they arise. Share power with patients by involving them in the decision-making and respect their autonomy. This means engaging in ongoing conversations about their care options and preferences, providing them with the tools they need to make informed decisions, and encouraging them to express their needs and concerns openly. Prioritize cultural safety by honoring patients' diverse experiences and traditions. Be open to learning about cultural practices and tailor care to be culturally appropriate. It's important to approach conversations with humility and curiosity, continuously learning and evolving to create an environment where patients feel valued and understood. And finally, remain flexible with treatment options. This may involve discussing different treatments, acknowledging potential barriers to access, and offering choices that feel right for the individual. Most importantly, all treatment decisions should be made with ongoing, informed consent, ensuring that patients feel comfortable at every stage of their care. Now let's focus on how to apply all the important pieces we've discussed when navigating cannabis use with Indigenous women and gender-diverse patients. In this section, we'll explore more about cannabis use, harm reduction, and help guide supportive conversations. Harm reduction is an evidence-based, patient-centered approach that focuses on reducing the health and social harms associated with actions that have a risk. It emphasizes meeting people where they're at and supporting them in ways that align with their individual goals and circumstances. Unlike traditional approaches to substance use that often demand abstinence, harm reduction provides a more inclusive and flexible alternative. By using non-judgmental and non-coercive strategies, harm reduction minimizes risk while offering opportunities to connect people with resources, peer support, and services, ultimately reducing substance-related health and social challenges. When it comes to Indigenous patients, there are additional considerations to take into account. As we've discussed, systemic racism in healthcare continues to act as a barrier, preventing many Indigenous women and gender-diverse people from accessing culturally safe supports for cannabis use. Additionally, resources and services are often concentrated in urban centers, leaving rural and remote communities underserved. It's vital to envision how supportive care could be adapted to these settings to ensure equitable access. Through a harm reduction approach, we can help build supportive environments where patients have the power to pursue health and wellness in a way that's authentic to them. Now let's dive deeper into understanding cannabis, beginning with foundational concepts. Cannabinoids are the active chemical in cannabis plants that interact with our body and brain when consumed. There are over 100 different cannabinoids, and they work by interacting with a system in our body called the endocannabinoid system, or ECS. Interestingly, our bodies naturally produce similar chemicals, known as endocannabinoids, which play an essential role in regulating stress, mental health, immunity, and overall wellness. Cannabinoids from cannabis mimic these natural chemicals, fitting into the ECS in much the same way and influencing how our bodies respond. The two most well-known cannabinoids are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC is responsible for the psychoactive effects of cannabis, commonly referred to as the high. It works by fitting into the ECS like a key in a lock, temporarily replacing the body's own endocannabinoids. On the other hand, CBD typically does not produce a high. Instead, it interacts with the ECS to enhance the effects of our natural endocannabinoids. CBD may even reduce some of THC's psychoactive effects if it's present in equal or greater amounts. While CBD is often thought of as the medicinal cannabinoid, it's important to note that THC also has therapeutic potentials. In medical cannabis use, people often use a combination of cannabinoids, as both THC and CBD offer unique benefits depending on the condition being treated. When it comes to choosing cannabis products, it's helpful to categorize them into three main types based on their THC and CBD content. THC-dominant products are high in THC and have minimal CBD, resulting in stronger euphoric effects, or high. However, these products also carry a greater risk of undesirable effects like paranoia or discomfort, especially at higher doses. CBD-dominant products, on the other hand, are high in CBD and low in THC, offering little to no high, and generally a milder, more relaxing experience. Lastly, balanced products have a mix of THC and CBD in ratios like 1:1, 1:2, or 1:3. These are more likely to create a relaxing, body-focused effect with less of the stimulating high associated with THC. Beyond the product type, the method of consumption is also a key factor. Cannabis can be consumed in various ways, including smoking, vaping, ingestion, sublingual drops, topical applications, juicing, nasal sprays, suppositories, and transdermal patches. Each method has unique effects, durations, and purposes, which is why finding the right combination of product and consumption method can be a trial and error process. It's essential to consider individual needs and goals to identify the most suitable option. Something important to consider is the intention behind cannabis use. Intention is critical to the outcomes of health and wellness. The way we approach plant medicine, our mindset, purpose, and respect, determines the relationship we cultivate with it. When cannabis is utilized with mindfulness, it can help align the individual better to its purpose. Without intention, there's a risk of becoming disconnected from the traditional values and teachings associated with it. Cannabis has historically had a variety of uses for Indigenous people. Beyond practical applications, such as using hemp for tools, various forms of cannabis consumption have also promoted balance and healing by addressing physical ailments, calming the mind, and fostering emotional and spiritual connection, reflection, and grounding. For some, cannabis also represents a connection to land and sustainability, reinforcing its role as a sacred plant, intertwining cultural practices and environmental harmony.
This highlights just some of the various multifaceted and deeply rooted relationships Indigenous people may have with cannabis. As a health professional, it's important to approach conversations with respect and recognition of how relationships with cannabis use are diverse and shaped by unique historical, cultural, and social contexts. Avoid making assumptions about why someone uses cannabis or the potential impacts it may have on their health or well-being. Instead, create a safe and open place for discussion that respects the individual's experiences and choices around cannabis use. In Canada, cannabis is legal for adults who meet the minimum age requirement, which ranges from 18 to 21, depending on the province or territory. In Alberta, the legal age is 18. In Quebec, it's 21, and all other provinces and territories, it's 19. Adults have the right to include cannabis in their personal health and wellness practices, and respecting their autonomy in that choice is key. Most cannabis research is still in early stages due to regulatory processes. It takes years to gain approvals, secure funding, and pass preclinical trials before clinical trials involving humans can take place. However, it's becoming increasingly recognized for its potential to alleviate various physical and mental symptoms, such as pain, anxiety, PTSD, nausea, vomiting, for palliative end-of-life transitions, sleep disorders, among many other uses. As a result, many people are turning to cannabis to help manage their chronic health conditions. Additionally, cannabis can also help manage withdrawal symptoms, making it a supportive option for those transitioning away from other substances. For instance, it's a legitimate and safer option for pain management, particularly for those who may otherwise rely on opioids. Long-term opioid use carries risks of significant health and social harms, including the potential for drug poisoning. In contrast, cannabis offers pain relief without the severe side effects associated with opioids. While there still are risks with cannabis use and potential for dependency, it could be an option when abstinence from other substances is not realistic for someone. Considering the use of cannabis as an alternative to other substances is especially relevant for Indigenous people, as they're disproportionately impacted by the drug poisoning crisis. Systemic inequities and ongoing traumas have contributed to higher rates of substance use in Indigenous communities, and cannabis may provide a culturally safe alternative harm reduction strategy to mitigate these risks in certain scenarios.
In discussing the medicinal benefits of cannabis, it's also important to acknowledge that there is a risk that cannabis use can become problematic. Cannabis use disorder, or CUD, is a condition that can develop with regular cannabis use over time. While cannabis use itself is not inherently problematic, regular use over a prolonged period can lead to mild physical dependence, and stopping can cause mild withdrawal symptoms. However, not everyone who uses cannabis regularly will experience these effects. CUD is a medical term used to describe a spectrum of cannabis use patterns, ranging from mild to severe. The condition is diagnosed when a person experiences at least 2 of the symptoms consistently over a 12-month period. These symptoms are listed on the slide and include things like using larger amounts of cannabis than intended, trying to unsuccessfully cut down, or continuing to use despite negative consequences at work, school, or in relationships. It's important to note that while these symptoms are used to define CUD, most people who use cannabis will not experience all or even any of them. Regular cannabis use or enjoying cannabis does not necessarily equate to problematic use. However, if any of these symptoms apply and cannabis use is negatively impacting a person's life, it may be time for them to reassess their relationship with cannabis and consider taking a break. This slide provides guidance and tips for supporting patients to mitigate the risks of cannabis use from a harm reduction lens. First, it's important to understand that cannabis use can lead to tolerance over time, meaning the body's cannabis receptors stop reacting as strongly to THC. This is reversible, and a tolerance break, where a person abstains from using any THC for at least 2 weeks, can help reset this sensitivity. For people who use cannabis more heavily, it may take up to a month, but even after a few days, the body's receptors will begin to reverse the tolerance. While THC tolerance builds up, CBD interacts with the body's receptors differently, making it unlikely for people to develop a tolerance to CBD. This provides an alternative option for some people who may not want to take a full break from cannabis. They could use CBD products for therapeutic benefit or to manage withdrawal symptoms without the risk of tolerance. If a patient's either unwilling or unable to take a full tolerance break, you can help them explore other strategies. For example, switching strains can provide a different cannabinoid profile that may help mitigate tolerance. Using more balanced products with higher CBD and little to no THC is another option. Additionally, microdosing involves consuming small amounts of cannabis throughout the day, allowing patients to gain the therapeutic effects of THC without building tolerance. Another option that may work for some people is varying their routines. Consuming cannabis at the same time every day can cause the body to expect stronger effects, leading to greater consumption. Waiting until later in the day or switching up the time of use could help manage this. Lastly, you could suggest using smaller amounts of cannabis, like smaller rolling papers or bowls, or even opting for edibles, which offer a longer lasting effect with less cannabis. Tailoring cannabis conversations involves a thoughtful, culturally respectful approach. Let's briefly review the foundational principles we've discussed. Ensure care environments are culturally safe and sensitive to past and ongoing trauma. Respect and affirm the intersecting identities of Indigenous women and gender-diverse people. Blend traditional Indigenous healing practices with Western health approaches to provide more holistic wellness. Consider how social determinants of health may impact the health and access to care. Emphasize practical harm reduction strategies that align with the patient's goal and minimize risks. Now, a key aspect of tailoring cannabis conversations is providing individualized advice. This involves understanding and addressing each patient's unique needs, experiences, and contexts. For beginners, this may mean starting with education on cannabis basics, such as the difference between THC and CBD, consumption methods, and potential effects. For someone who's a more regular user, guidance may focus on managing tolerance and refining usage to align with their long-term health and social goals. Some things to consider when supporting cannabis use in patients are helping patients understand strains or products that match their preferences, therapeutic needs, and underlying medical conditions. For example, patients managing anxiety may benefit from CBD-dominant products, while those addressing chronic pain might explore balanced THC-CBD options. Offer practical advice on forms of cannabis, like edibles, oils, or topicals, and methods of consumption that align with the patient's comfort level and goals. Discuss harm reduction methods around use and what effects they might expect, including things to monitor. And finally, ensure that recommendations resonate with the individual's personal and cultural context. When discussing cannabis use with youth, it's important to emphasize the heightened risks due to the brain's ongoing development until around age 25. Regular cannabis use during this critical period can have lasting effects on both physical and mental health. Physically, cannabis can affect brain function, leading to challenges with memory, concentration, and decision-making. There's also a risk of developing a physical dependency on cannabis, which can make it harder for youth to reduce or stop their use. Additionally, youth who use cannabis regularly are more likely to smoke cigarettes and experience respiratory issues similar to those caused by tobacco use. There are also mental health risks. Regular cannabis use in youth increases the likelihood of experiencing anxiety, depression, psychosis, and in some cases, schizophrenia. Beyond health risks, cannabis use may also affect a young person's overall life trajectory. Recreational use could lead to reduced academic performance, diminished participation in extracurricular activities, and a lack of interest in hobbies or peer groups they once enjoyed. These changes could compound feelings of isolation and strain in relationships with family and friends. To address these risks effectively, it's crucial to foster ongoing, open, and non-judgmental conversations about cannabis. These discussions should be grounded in evidence-based information, presenting both the risks and potential benefits of cannabis use. Presenting the positives of cannabis use is important because it helps inform youth that cannabis is not always bad, and that there's many circumstances where cannabis use can be helpful. This helps counteract stigma and encourages youth to engage in thoughtful, informed decision-making. Ask open-ended questions, use accessible language, and promote harm reduction strategies. For example, you can encourage reducing use, opting for lower THC products, and avoiding mixing cannabis with other substances. By creating a supportive and balanced dialogue, you can help share power with youth to navigate their relationship with cannabis in a way that prioritizes their health and autonomy. Finally, we'll touch on some key considerations as it pertains to cannabis use. The stigma surrounding cannabis use is deeply rooted in colonial systems of control. Extending beyond criminalizing a plant, these laws represent broader racist policies aimed at policing Indigenous bodies and cultural connections to plant medicine. Prohibition reinforced harmful stereotypes, and that legacy continues to shape how Indigenous people perceive and access cannabis, especially within the context of health and social care systems. When working with Indigenous women and gender-diverse people, it's essential to consider how intersectional experiences, such as gender identity, sexual orientation, socioeconomic status, disability, and culture, can compound stigmatization and create additional barriers. Care provision must be approached from culturally safe and trauma-informed lenses to ensure equitable and compassionate support for a person's complex health and social needs. Another essential approach is using non-stigmatizing language. Words and language are powerful for creating connections and fostering trust and respect in relationships. Avoiding language that perpetuates stereotypes or demonstrates judgment can help create open spaces for more supportive dialogue surrounding cannabis use and its role in well-being. Finally, it's important to acknowledge the diversity of viewpoints Indigenous communities and individuals hold around cannabis. While many embrace cannabis and connect it to cultural practices and traditions, many also outright reject and oppose it due to legacies of colonial trauma and influences driving stereotypes. This polarization can result in people who use cannabis being excluded from community ceremonies or events. It's important to approach cannabis conversations sensitively. Perspectives and experiences will differ across individuals, communities, regions, and generations. Let's move into a practical application of these concepts. In this section, we'll explore a case study featuring an example of how healthcare professionals might respond to a patient accessing cannabis. This will highlight both the challenges and opportunities for improving patient care through culturally safe and trauma-informed approaches. Before we get started, we want to acknowledge that this case study is fictional. However, it was developed by the advisory circle based on personal insights and real lived experiences of working in and interacting with healthcare settings. This case study presents Nita's experience. Her background highlights common challenges faced by Indigenous patients when accessing healthcare resources. Nita, they, a 54-year-old Indigenous woman, visits a pharmacy to fill her first prescription for medical cannabis, eager to try it for chronic pain management. Nita presents her status card to the pharmacist to access her account and expresses her excitement about this new treatment. After the initial exchange, Nita noticed the pharmacist whispering to another staff member. As Nita browses the store while waiting, she becomes aware that a staff member appears to be following her, monitoring her movements from aisle to aisle. Meanwhile, as the pharmacist fills her prescription, they notice the high dosage, but assume Nita may already be familiar with strong pain medications or recreational substances based on her background. They choose not to inquire further. When Nita returns to the counter, she's surprised to learn that cannabis is not covered by her non-insured health benefits. With no alternative presented, she pays out of pocket for the medication. The pharmacist, without further discussion, hands over the medication and continues their work. Nita's experience highlights many key barriers Indigenous people often face in accessing healthcare. Starting with the distrust from the pharmacist, the whispered conversations and surveillance she endured suggest explicit bias, leading her to feel judged and unwelcome. Such experiences discourage engagement with health professionals and may prevent her from seeking care in the future, perpetuating a cycle of avoidance and health inequity. Nita was stereotyped and profiled in this interaction. The assumption that she might be familiar with high-dosage pain medication, simply based on her identity, reflects systemic biases and reinforces harmful stereotypes.
This kind of treatment not only affects Nita's dignity, but also perpetuates racism and discrimination in healthcare environments. The pharmacist's failure to question or discuss the inappropriate dosage further illustrates a lack of culturally safe care. Assuming expertise without proper consultation disregards Nita's individual needs and increases the risk of adverse effects, including improper symptom management or potentially negative outcomes from an excessive dose. Adding to this, the lack of financial support and follow-up resources left Nita vulnerable. When cannabis wasn't covered by her NIHB benefits, she was forced to pay out of pocket without being informed of possible alternatives, such as financial assistance programs or other cost-effective solutions. These barriers culminate in the potential for discontinuation of treatment. The combination of financial strain, feeling judged, and an ineffective dosage may push Nita to abandon cannabis altogether. This could force her back to managing her symptoms with other pharmaceuticals that may be more harmful to her health, contrary to her initial goal of seeking a more natural pain management. Further, an interaction like this may deter Nita from going to pharmacists or other health professionals for help in other situations, which has the potential to directly worsen her future health outcomes. Finally, the lack of autonomy and respect in her care underscores the broader systemic issues. Nita wasn't treated as a partner in her healthcare plan. Respectful, collaborative care requires transparency and shared decision-making to foster agency and trust. In Nita's case, the pharmacist could have fostered a much more supportive and respectful interaction by focusing on key elements of culturally safe care. First, building trust and respect is essential. Greeting Nita warmly and engaging in transparent communication would have set a positive tone. Instead of whispering or appearing secretive, the staff should treat her with the same openness given to all customers. Avoiding behaviors like surveillance is crucial, as these actions signal explicit bias and racism towards Nita. Second, providing culturally safe care involves addressing concerns collaboratively. Instead of assuming her familiarity with high-dosage medications, the pharmacist could have engaged in a respectful conversation, asking about her experience and reviewing the prescription together. Early transparency about the non-insured health benefits coverage would have allowed Nita to make an informed decision, and financial alternative supports could have been discussed proactively. Third, enhancing communication and collaboration helps ensure that Nita feels supported. Inviting her to ask questions about her treatment plan fosters a shared decision-making approach. Additionally, offering follow-up resources, such as Indigenous cannabis resources or community support services, would provide ongoing support for managing any holistic concerns she may have. And finally, addressing power dynamics is critical. Healthcare professionals must model humility, recognizing that Nita is the expert in her own health journey. Asking for her feedback on the service provided encourages dialogue and improves future care. By implementing these steps, the pharmacist could have created a caring environment where Nita felt valued, respected, and fully supported in her health journey. In reflecting on the case study with Nita, several key takeaways emerge that are crucial for providing effective, culturally safe care. Structural racism and biases are deeply embedded in healthcare systems. Health professionals must recognize these biases and how they can affect their interactions and decision-making. Active efforts, such as anti-racism training, continuous self-reflection, and awareness of systemic inequities, are essential in mitigating bias. It's crucial to ensure that all patients receive respectful, equitable care. Cannabis is often misunderstood, and assumptions about its use can lead to harmful treatment practices. In Nita's case, the pharmacist assumed she was experienced with high-dosage medications based solely on her identity. Such assumptions can compromise the quality of care and lead to ineffective treatment. Cannabis use should be considered with the same care and thoroughness as any other medication. Health professionals must approach this without preconceived notions, ensuring individualized treatment plans that reflect the patient's actual needs and experiences. Health professionals, including pharmacists, are a crucial part of healthcare teams. When concerns arise about medication or treatment options suitability for a patient, it's essential to communicate these concerns with the person and collaborate with the prescribing provider to determine the best course of action. Health professionals do not work in isolation. They're integral members of a healthcare team who can offer valuable insights into care plans. It's important to share expertise and make recommendations that ensure patients receive the most appropriate, well-rounded care. Effective collaboration among healthcare providers leads to better patient outcomes. In Nita's case, a more coordinated approach between the pharmacist, the prescribing physician, and even community supports could have resulted in a more suitable treatment plan. Collaboration allows providers to share insights, discuss concerns, and develop care plans that are tailored to the person's needs. Additionally, collaboration with the patient is crucial for shared decision-making, ensuring their preferences, values, and cultural contexts are integrated into their treatment plans. Finally, a safe healthcare environment is foundational to patient trust and engagement. In Nita's case, being surveilled and judged led to feelings of discomfort and alienation. Health professionals must cultivate environments where patients feel respected, valued, and free from judgment. Listening actively, showing empathy, and creating spaces where people feel comfortable discussing their concerns are key components to building trust. In summary, by implementing the key takeaways from this case study, health professionals can improve their interactions with Indigenous patients, enhance outcomes, and contribute to more inclusive and equitable healthcare environments.
This next section highlights Indigenous-specific resources that promote culturally relevant cannabis education and harm reduction practices. Many of these initiatives are designed by and for Indigenous communities, integrating traditional knowledge, lived experiences, and trauma-informed approaches. The first Indigenous-led initiative we'd like to highlight is NWAC's Cannabis Education website. This website is part of a larger project titled A Community-Informed Approach to Cannabis Public Health Education and Awareness. Through this project, NWAC engaged urban, rural, and remote Indigenous communities and identified the current awareness and priorities of Indigenous women and gender-diverse people around cannabis public health education. This website offers a wealth of tools and information. Cannabis in Canada explains how to read labels, understand consumption methods, assess potency, and navigate cannabis laws across provinces and territories. Cannabis Basics covers the anatomy of cannabis, differences between compounds like THC, CBD, and terpenes, growing and harvesting practices, and debunks myths. History and Traditional Stories includes an elders section with personal accounts and a historical timeline of cannabis in Canada. The cannabinoid dose calculator helps people, whether new or experienced, determine the best dosages for their needs. Paired with the cannabis dosing and symptom log, this tool supports personalized and informed cannabis use. Cannabis and Health features detailed sections on parenting, youth, pregnancy, lactation, seniors, and the use of cannabis with other substances. Cannabis and Medical Use guides people through the prescription process, helping them decide if medical cannabis is right for them and what to expect. Cannabis Use Disorder explores diagnostic criteria, tolerance management, and cannabinoid hyperemesis syndrome, offering strategies like reducing dosing or tolerance breaks. And finally, the resource section provides downloadable fact sheets in English, French, and Inuktitut, and access to NWAC's published reports on cannabis education, cannabis and mental health, and cannabis use during the perinatal and postpartum period. There are also many resources provided by the First Nations Health Authority. The Care Through Connection Cannabis Use Across a Lifespan document is designed to support healthcare providers in facilitating open, compassionate conversations about cannabis use. It emphasizes a harm reduction approach that's person-centered, trauma-informed, and culturally safe, ensuring that providers are well-equipped to offer care to First Nations people. In addition, their website offers a range of valuable tools and information, including mobile apps for managing mental health, cannabis resources for both healthcare providers and the community, educational materials on cannabis, maternal health, safer cannabis use, and support for youth. The State of Métis Knowledge on Cannabis and Mental Health in Canada is a key resource developed by the Métis Nation Council. This document provides a high-level overview of cannabis use in Canada and its relationship with mental health, specifically to inform future research areas for Métis communities. The report identifies significant gaps in the existing literature regarding cannabis use and mental health outcomes for Métis people, a critical limitation requiring further attention.
This is a valuable tool for fostering discussions around creating more inclusive and Métis-focused research and resources. Let's talk about UJREC, is a cannabis harm reduction toolkit created by the Paututik Inuit Women of Canada. This toolkit is guided by Inuit values and is designed to increase knowledge around cannabis use and how to reduce potential harms, all while taking a trauma-informed and strength-based approach. These materials are tailored to support new and expecting parents, youth, and the broader Inuit community in making informed decisions about cannabis use. Service providers can also benefit from these resources. For example, the discussion guides for starting conversations around cannabis use provide practical strategies for initiating supportive dialogues. The Reflecting on My Cannabis Use tool is a short, anonymous activity designed to help individuals reflect on their cannabis use, assess its impacts, and explore relevant resources based on their decisions. Additionally, the toolkit features beautifully designed posters and fact sheets available in English and several Inuit languages. These materials are perfect for display in workplaces or community settings to increase awareness and spark conversations. There are a few research resources that would be valuable for understanding various topics surrounding cannabis and health. MWAC's research paper titled Conversations on Cannabis and Mental Health was published in 2023 in the International Journal of Indigenous Health. This explores the needs and experiences of Indigenous people regarding cannabis use and mental health, with 4 key recommendations being outlined. There's also the Canadian Centre of Substance Use and Addictions report, titled Clearing the Smoke on Cannabis. This was published in 2024 and presents up-to-date research findings for cannabis use for a variety of health issues, such as pain, cancer, fibromyalgia, neurological disorders, and substance use disorders. Another useful resource is Health Canada's Information for Healthcare Professionals website, and although this was published in 2018 and is not currently up to date, it does provide an extensive background summary of cannabis health research and details recommendations and advice surrounding topics like clinical pharmacology, dosing, potential therapeutic uses, precautions, and adverse effects. This slide also provides a few additional resources that can support further learning and practices related to Indigenous cannabis use. These resources include toolkits, policy documents, and research findings that highlight different perspectives, challenges, and approaches to cannabis use within Indigenous communities. To conclude, we wanted to highlight NWAC's Anti-Indigenous Racism Toolkit for health and social care providers. This resource is designed to support health and social care professionals in addressing and reducing racism in their daily practices. The toolkit acknowledges the challenges Indigenous people, especially women, girls, Two-Spirit, transgender, and gender-diverse individuals, face when accessing services. Many have experienced systemic racism or medical trauma, making these interactions intimidating or re-traumatizing. Practical strategies include tools like post-visit surveys to collect feedback in a safe way, and guidance on understanding the needs of Indigenous patients. We encourage you to explore this toolkit and consider how its principles can enhance your practice. That brings us to the end of this presentation. Thank you for taking the time to engage with this important topic.